want to welcome everyone. It's really nice to see all of our Title IV students here, as well as a number of people from the community as well. And I think that the content for today's lecture will be relevant to all of you. So just to give you a little bit of background for those of you who don't know this, we have a lecture series that's sponsored by the Title IV training program at UW-Madison. We are a federally funded program that comes to us that's sponsored by the state. And one of the things, other than supporting our students and our courses, one of the things that this allows us to do is to bring in national speakers to talk about the issues that are really relevant in public child welfare in Wisconsin right now. And so we do one of these in the fall, we do one of these in the spring, and we're just really excited to see a group of people, a nice diverse group of people here today. So I'm going to go ahead and get started and introduce our speaker. We have today Courtney is our dialogue speaker this spring. A little bit of background on him. He's a professor at the School of Social Service Administration at the University of Chicago. His fields of interest are child welfare policy and services, the connection between child welfare services and other institutions serving families living in poverty, the transition to adulthood for vulnerable populations, and the professionalization of social work. He's a faculty affiliate of Chapin Hall at the University of Chicago, which he served as director from 2001 to 2006. He also served on the faculty at the University of Wisconsin here, and many of you probably, the people that I remember in the audience remember those days, 1992 to 2000, and then also at the University of Washington. Dr. Courtney is a recipient of the Distinguished Career Achievement Award from the Society for Social Work and Research and the Peter Forsyth Award for Leadership in Public Child Welfare from the National Association of Public Child Welfare Administrators. He obtained his MSW and Ph.D. degrees from the School of Social Welfare at the University of California at Berkeley. Before moving into academia, he worked for several years in various capacities, providing group home care to abused and neglected adolescents. And he has served as a consultant to the federal government, state departments of social services, local public and private child welfare agencies, and also the philanthropic community. So he's going to talk with us today about his current work and some of his practice experiences. Welcome.
Thanks. There we go. It's great to be here. Before I get into this, there's a little bit of my practice history in the talk here, but yeah, I was here for 7 years. I have a lot of fond memories of Wisconsin. My first child was born 6 weeks after we moved here, so it was a pretty auspicious time. And both of my daughters were little cheeseheads. They were both born here and spent the first few years in Wisconsin. And my younger daughter is now living in Olympia, Washington, and was very upset when she watched the Packers-Seattle game, and the end of it, she said, "I broke things," and ran out of the room. The other people were so happy I couldn't stand it. So anyway, I have fond memories of the place and dear friends here. So yeah, today I'm going to talk about, while I've done work on a wide range of topics on child welfare services and policy, this particular topic is really important to me for reasons that I think will become clear as I get into the talk. And let me see if I can get this to work. It doesn't matter. I can use a button. It's okay. I mean, oh, now it's on. That helps. Okay. So what am I going to do today? I'm going to explain my rationale for studying youth making the transition to adulthood out of foster care. I've got personal reasons, but there's a lot of other important reasons to understand how this group is doing. Explain how policy can reasonably be expected to affect outcomes for this population. And I think this is a good way to think about policy generally as a tool. I think sometimes people have magical beliefs around what policy can accomplish, and so it's good. A lot of my work over the years has been on the implementation of policy, and I actually think social workers, that's kind of what we're closest to in terms of policy. We certainly have people making policy, but all social workers are implementing policy, and so thinking about what that entails and what you can really get out of a good policy is, I think, useful for social workers. I'm going to propose a term that gets used in the United Kingdom a fair amount, They would know if you were talking to a group like this and use this term corporate parenting, they would know what that means. Corporate kind of has a weird connotation here, but I'm going to make an argument that that's a good way to think about how the responsibility we bear toward children in out-of-home care in this country. I'm going to describe the evolution of U.S. policy for this population. And then along the way, I'm going to share the findings of my research and then some related research, but a lot of the research, this program Research of Mine sort of goes along with these policy developments and has influenced them and reflected the developments in those. And then I'm going to talk about the implications of the research for policy mainly in practice and a little bit for future research. So before getting into how young people transitioning to adulthood out of the child welfare system or foster care system are doing, I think it's important to understand how young people generally, what does this look like generally? Because too often those of us working in these systems can lose track of what is normative. I use that term not to make judgments, but just to sort of put in context what life looks like for people who aren't in the systems that we're dealing with, in this case, young people who are getting ready to make the transition to adulthood. And as Ellen said, I don't want to claim that this is the implication she made, but a whole lot of you are actually in the age range that I study, maybe a little the older part of it, but anyway, scholars, particularly demographers, people who study population dynamics, but also developmental psychologists, economists, have observed that over the last several decades, probably 40 years, certainly since the post-Second World War period, markers of what we think of as being an adult. So living on your own, finishing your education, being financially independent, starting a family. The career part of it's a little tricky because these days career is kind of not that many people have careers, but having some sense is what I'm going to do, at least for a while. Those things are happening later in the life course. They're happening, well into the 20s, and that's a big change. It's something that happened, sort of crept up on policymakers certainly, but it's something that's well known to demographers. The one statistic I provide here that I think illustrates this is half of young people between 18 and 24 in this country are living with one or both of their parents. 1/4 of 24-year-olds in this country are living with one or both of their parents. That would not have been the case 30, 40 years ago. And families provide a lot of concrete economic support. So this study by Bob Shaney and I think her name's Karen Ross estimated that young people get about $38,000 in direct economic support between 18 and 34 from their families. That doesn't count in-kind support, like things like child care, for example. Developmental psychologists, notably Jeff Arnett. I don't know how many of you read, he's a famous guy these days, developmental psychology, around the notion of emerging adulthood. Wrote a paper in American Psychologist. There's actually a journal that he edits and a conference every other year on emerging adulthood. And the notion of emerging adulthood is this period of the 20s, even maybe into the early 30s, is a period of experimentation. That it's not adolescence, these are adults, but it's not, in his sense, sort of fully formed adults from a developmental standpoint. Young people experimenting with identity, with relationships, with what they want to do with their employment, etc. One criticism of Arnett, and he has a little paragraph in his paper on emerging adulthood where he says, well, there's actually a lot of young people maybe who don't have the luxury of all this experimentation. He hasn't paid much attention to them in his own work. My work, I would say, looks at that other half, really. But nevertheless, that's a popular idea, that this is a period of time when young people experiment. It gets, I think, oversimplified in the media, the notion of failure to launch and things like that. And but anyway, you get the sense it's even in sort of popular psychology, we're talking about it. And then more recently, neuroscientists have made a strong case that actually brain development continues well into the 20s. And it continues in areas of the brain that have a lot to do with kind of important things during this period, like deferred gratification, some decision-making about long-term, being able to control one's thoughts around decision-making, things that arguably mean that young people in this period are in fact developing, psychologically or not, in terms of their neurons. Their brains are developing in ways that are very important to things that are going on in their lives. And in fact, this research has been very influential in the shift in the Supreme Court's decision, for example, to roll back the juvenile death penalty, was Larry Steinberg's work in particular, very influential in the Supreme Court saying, well, we shouldn't be killing minors because their brains are developing. And those of you interested in this developmental period, I don't have the citation here, but the National Research Council Institute on Medicine, which is charged by the federal government to answer important questions, pull together scientists to bring together what the consensus in areas. So we have had them on smoking, climate change, things like that. There's actually an IOM NRC panel that I was on the health and well-being of young adults, and we just issued our report maybe 2 or 3 months ago. And you can find it very easily if you just Google health and well-being of young adults, IOM, you'll find this report, and it's great because it pulled together. I learned a lot being on the panel. I was more focused on what we call marginalized youth, but the report talks about all young people from 18 to 26. So that's the normative thing, right? This is people do not snap their fingers at the age of 18 and become independent. Not that they probably ever did that, but they certainly are doing that now. So that's kind of the normal context, if you like, of the transition to adulthood. Yet, U.S. social policy provides relatively little support for young adults. So it's changing a bit. But a lot of our systems end at 18. We have a whole bunch of systems, high school, our Medicaid program up until it still does, depending on what state you're in. Basically, if you're a minor and you're in a low-income family, you have medical insurance, right? When you're 18, you cease to have medical insurance unless you're in one of the states that has decided to implement the extended Medicaid provisions under the Affordable Care Act. The states that have decided not to do that, unless you're on your parents' insurance, you will lose health insurance, right? So there's a lot of things that end at that point. We have youth employment programs that end on around 18. We have mental health services end around, and we have a child welfare system that still in most states essentially ends providing out-of-home care at 18. Those states will all say in their Title IV-E plan, you are 4E stipend earners. They will all say in their 4E plan that they provide services to 21, and many of those states, that and $3 will get you a cup of coffee. I mean, there's very little that in fact gets provided after the age of 18 in those states, both because they don't provide much, but also because if you think about it, if the state was housing you, they were your parent, and then suddenly they abdicated that responsibility at the age of 18, you may not be looking to them for help after the age of 18. So it turns out it's actually not that easy to engage young people who age out of care in the states that on paper say they're providing services to age 21. Later on, I'll talk about that actually here in the state of Wisconsin, the study that I did in Wisconsin and 2 other states, contiguous states. One area where we do have a lot of policy, and I'm going to talk about that a lot today, is around this population. We actually have policy specifically devoted to recognizing that there is something called the transition to adulthood, and we need to help young people through it just for this population going all the way back to the late 80s. In fact, if you look at U.S. social policy back in the late 80s, there was nothing on the transition to adulthood except for this population. And as I mentioned, little attention in particular to the ones that, I would say the policy we have for young adults, with the exception of the change in the Affordable Care Act that lets young people stay on their parents' insurance at 26, and in the states that have taken up the Medicaid extension, single adults without children who are under a certain income, is education, post-secondary education. Major subsidies for post-secondary education, many of which actually go to middle-class families. Yes, we have Pell Grant programs, low-income families, but a lot of the subsidies, a lot of the underwriting of interest for student education, and direct expenditures to higher education by states, for example. The state is cutting back. A lot of states are cutting back. Nevertheless, states still spend lots of money on post-secondary education, and middle-class folks are much more likely to avail themselves of that than the other half, than poor folks. So why study foster youth? Well, first of all, for me, it's personal. As Ellen mentioned, I actually worked for a place called Bay Area Youth Centers. It's now a division of Sunny Hill Services, mergers and acquisitions in the human services realm. But I worked in the agency for 5 years. Was studying to be a clinical psychologist, and did a role play interview with somebody in my class. So you've probably done that kind of thing. And she was talking about this group home agency she worked in. And it sounded great. I wanted to work with young people. I went and applied for a job there. She said, we're hiring. I went and applied for a job there, got the job. She quit about 6 weeks later because she decided she just couldn't stand teenagers. She had been doing the work maybe 2 or 3 weeks when I did the interview, and she was out of there within 2 months. But I loved teenagers and worked in the agency as a live-in group home counselor for about 2 years. 3 days on, 4 days off, and then 1 weekend a month. These were homes that were not, it was not a residential treatment center. Our young people went to the public high schools, and it was in southern Alameda County. That might not mean much to most of you, but in the San Francisco Bay Area, Alameda County is across the bay from San Francisco. It's Berkeley, Richmond, Oakland, Hayward, San Leandro are the main communities there. Also Livermore, which is further east. Our homes were all in Hayward, San Leandro, right on the border of East Oakland, which is where most of our young people came from. They were all, low income, mostly people of color. So I did that for 2 years, and then I got my master's degree in clinical psych, became a clinical supervisor of 3 of the homes. So I hired and trained staff that worked in the homes. I ran groups in the homes. I spent half of my 40 hours or so, quite often more than 40 hours a week, in the homes. So it's personal, and one of the things that was really, and since then, I've been working with child welfare services, policymakers, program managers, and practitioners. But one of the things that really troubled me at that time, our home was for 12 to 18-year-olds, not many 12-year-olds, mainly we had 2 shelters, short-term facilities, but then 5 long-term homes, and these were generally young people who had been in a bunch of foster homes that hadn't worked out, or maybe it was a big sibling group, and then they would come live with us, and many of them lived there for a few years. But then on their 18th birthday, the counties that placed with us would basically say, you must discharge them because we want that bed for somebody else. And so I used to like birthdays that fell on a Friday because the county wouldn't get it together to place somebody in the bed till Monday. So at least that young person had a couple more days of housing from us. At the time, that seemed really bittersweet, right? We're celebrating a very important transition. Young people are excited about being adults, and they are instantly basically on their own. And that was very troubling. And I, won't get into the examples here. I mean, some of them did okay, but way too many of them, that was instantly a bad thing for them. And they became homeless, had to engage in survival behaviors that were harmful to them, they had to drop out of school, all kinds of bad things happened at that point. So at the time, it made no sense to me, and that's why, among all the other things I've studied over the years, this is something that I've been fortunate enough to be able to work with my partners in the policy and practice community to sort of bear witness to the experience of the young people and try to improve policy and practice for them. But why else, other than my own personal reasons, trying to do penance for the inadequacy of the efforts of me and the other people in the agency back in the 80s, why else study foster youth? Well, first of all, they exhibit the characteristics of other so-called vulnerable transition populations. In our IOM report, we actually talk about marginalized youth. We had a long discussion about what terminology we wanted to use, and we decided instead of vulnerable or at risk, which tends to, intentionally or not, locate the problem in the individual, let's call them what they really are, which is marginalized young people. We have social processes, et cetera, that marginalize particular populations of people. These are young people who are marginalized. And so these young people exhibit a lot of the characteristics of other vulnerable populations. So they are behind in school. You're going to hear some of this. I'll go through a few, describe some of the outcomes in this research that I've done. But suffice it to say right now that young people aging out of care, on average, some of them are doing quite fine, but on average are significantly behind their peers in school. They're likely to have disabilities, both physical, but in particular psychiatric, mental health problems. They have a lot of justice system involvement, even if they're not in the probation system. A lot of them have had run-ins with the law before they ever turn 18. They have relations with their parents, a lot of them, but some of them don't. Maybe quarter to a third really don't have any relations with people in their family. And even those who do, those quite often are problematic for understandable reasons. And then, of course, they also are resilient, so I want to make clear that. But if you're trying to understand how to intervene with marginalized young people, and people are going to have a hard time, but we already know that, right? The subpopulations that we typically describe as marginalized are people with disabilities, Sexual minority youth, for example, they are overrepresented in the out-of-home care system. People behind in school, people of color, all these forms of being left out of the emerging adulthood period of, wow, it's great, I get to experiment, figure out what I want to do, they're all there, right? So if we can create interventions and policies that really move the outcome dial for this group, that raises a serious question of why aren't we doing that for a broader population? It's a small population. Some of my colleagues at policy research are like, Mark, why do you keep studying this? Like 23,000 of them a year, 25,000 a year, who cares? I said, well, personally I care, you know, and they are our kids, I'll say that in a minute. But also, we do have residual social policy in this country. There's a lot of things we don't do that other countries do to support our fellow man and woman, right? If we can show through evidence that doing that makes a big difference, right, then we've got a stronger case for expanding the social policy that benefits this population to other populations. So I think it's important to study this stuff and not just be happy that we changed the policy, because there's broader implications than just changing the policy for this group. As I already mentioned, federal and state policy already focus on this group a lot, so it's worth studying as social work scholars and thinking about as social workers to make sure that we're doing a good job of implementing the policy we already have. And then lastly, not because I think it's least, I think this is the most important reason, these are our children. Out-of-home care in this country is a manifestation of a long struggle for the community to say there are situations under which we will just not allow our fellow citizens to parent, right? That parenting is beyond the pale, it's unacceptable. We don't hopefully intervene to just maximize well-being. We're actually trying to, you know, protect people from situations that are unacceptable. When we do that, we take on the responsibility of being the parent. The court, the child welfare system, and I would argue society takes on that responsibility. And the reality is, I feel comfortable saying that because I have not heard a politician yet on either side of the aisle say, you know what, we really get rid of this whole child welfare system. Like, you know, we have no business trying to parent, you know, intervene in these families. None of them say that because they know that is a death knell politically, right? I mean, people overwhelmingly feel like there are circumstances under which we should step in as a community, as a society, and parent those kids. Now, of course, the state doesn't parent. The state, at best, can find other people to do that. But once we've done that, you know, as Colin Powell said about Iraq, you know, once you break it, you own it, right? I mean, once you take on young people, children, babies, whatever, and say, we're going to be a parent, then I think we have an obligation to do a better job of that. Otherwise, why do we step in? So these are our kids. We really can't abdicate that responsibility, and we should be concerned about the transition to adulthood for them because, you know, pretty much all the parents, I've never had anybody disagree with me. There's probably some out there, but it is not normative to abandon your children at the age of 18. You know, like the thought experiment I like to give is if you're, you know, within 10 years or so my age and you have adult children, a lot of people, legislators, by the way, are in this age range. They have kids this age. They wouldn't go to a cocktail party and say, my daughter just had her 18th birthday. I shook her hand, said, good luck, you're on your own. You would be a very unpopular person at that cocktail party. This is what I mean by normative. It is not normative to do what we do in far too many states still with these young people. So there are kids, let's not treat them that way. That's a value statement, but hopefully the research that I've done over the years has helped make a broader case for that. So before I get into that research and its relationship to policy, I want to talk about what policy actually does, because I think sometimes we can be confused about that. Make sure I push the right button and don't do something. Oops, I didn't. I pushed the wrong button. All right, I thought I had a light here, but oh, there's the light. Hey, there we go. All right. So what does social policy do? I'm talking about social policy here. Basically, social policy consists of a few things. It consists of the law, the statute. It consists of regulations. Actually, a lot of time I've spent been talking to people at the state level or the federal level about regulations. Quite often, that's much more important than the actual statute. And then resources. If you don't have resources to implement that stuff, you can have a nice policy on the books and it never gets implemented, right? So those are kind of key elements of policy. Policy does not, so I've got a few other boxes here. I've got developmental context, I've got youth characteristics and experience, and I've got their outcomes. ultimately, it's this arrow that policymakers, the public, that those of us who are social workers are interested in. How is policy going to affect these outcomes? And if you read the policy, I won't get into it right now, but if you read policy directed at this population, whether it's the Chafee Act or the Fostering Connections Act, that's absolutely what the policy is intended to do. It's supposed to affect these outcomes. But it doesn't do that directly. You know, it doesn't, boom, policy, outcome, right? It does it really through affecting the developmental context of these young people. So things like you could maybe help create supportive relationships, social support, connect them in a positive way to their family, or you could undermine that, right? We have policies that undermine that. I think quite often in the child welfare system, other work I've done on family reunification, when we sort of get past, well, we're not going to reunify the person right now, that's not the plan anymore, we way too often assume, and it's really dangerous with adolescents, that, oh, they don't have a family. We don't really need to pay attention to the family anymore. Well, guess what? They still have a family, right? And I've done this work for a while. I ask young people, so how was that for you? Did they help you maintain your relations with your family well while you were in care? And about a third of them say, absolutely not. In fact, they made it hard for me to do that. I've studied runaways. What's the main reason kids will say they run? They'll say, I wasn't a runaway. They let me a runaway. My mom was in the hospital. They wouldn't let me visit her. I went and visited her. They call me a runaway. So, you can have policies that support or undermine these things. We have both. The community. I mean, you don't think about that, but where is the young person living? Community context is very important. You can have policy that affects that. We don't think of that so much in child welfare, but we are actually, some of us have done that. We spatially mapped, here's the child where they were moved from, where did they go? How far did they go, right? Sometimes we look at that and we say, well, they went a long ways away. That makes reunification hard, but they might have gone to a nice middle-class suburb, so they're in a better school now. What do we make of that, right? I mean, so you got to think about how policy affects that, because you may have all kinds of intended or unintended consequences. And then the things that I think are easier to understand is concrete formal support. So, for example, a lot of my research has been used, you'll see later, to help make the case for allowing young people to remain in foster care to 21. And a lot of that argument really comes down to doing that, allowing young people to remain in care till 21 pretty much guarantees that they're going to have food to eat and they're going to have housing, right? Those are concrete supports. It's hard to provide those, by the way. Child welfare agencies that have not extended care to 21, none of them have been successful at doing that routinely for everybody who needs it, okay? Tuition, not so much. I mean, there are states that haven't extended care that actually provide tuition for all state universities. So if you're aging out of foster care and you can get in, your tuition's waived, right? So those are concrete supports, and then a lot of services, right? Is there somebody there for you to talk to? You've had this case manager, social worker, the whole time you've been in care. Maybe you don't see him much, once a month, whatever. Can you see him at all after you're 18, for example? How often can you see him? Is it appropriate? It may work with a baby in foster care for a social worker to visit the home once a month. I don't know any parent who only interacts with their 18, 19-year-old once a month. I don't know any. There are probably some out there, and maybe they're doing just fine. But most of the people I know, I got 3 text messages from my 18-year-old right now that I haven't responded to yet, And I don't consider myself a helicopter parent. She's just working on a paper on racial disparities in the child welfare system, so fair enough. We're corresponding a little more now than we normally do, but nevertheless, if you start thinking about what would normal support services, having those adults around, it's complicated, right? Maybe it doesn't need to be a case manager, but it needs to be somebody, right? Because young people have that. I see nodding heads because I know a lot of you've had those people in your lives. And those who haven't are acutely aware of that. I've had to do this on my own. That's really hard. It's not like my friends, not like the people I'm living with or in my dorm or whatever. They had a lot of people to talk to, folks that helped them along the way. And when they closed the dorms, they had a place to go, right? Euthanasia out of foster care, they don't always have that. So that's the stuff you affect. That, for the most part, has an impact on the youth characteristics experience. So they have human capital, so that's education, employment, et cetera. They have social capital. I'm using the sociological language here instead of the psychological. The connections that will connect them to information, we'll connect them to resources, jobs, etc. They have social skills, the ability to maintain, create, maintain relationships. They have life skills, balancing a checkbook, how to look for housing, stuff like that. And then, of course, they have experiences that are particular to foster youth, which becomes kind of a big deal, actually, because when you've been in the system, you end up getting used to getting particular things through mechanisms that are in the system that other young people get through other mechanisms. And then suddenly when you're not in the system, like that's not there anymore. And it's like really strange to you. It's fascinating having conversations with young people age out about that. The stuff that's strange for them is, I used to be able to, I had my clothing allowance. I don't have a clothing allowance anymore. I mean, just things that, but if you've had that every year for years, that's kind of what you're used to, and now you don't have that. Like, you're thinking, fall, clothing allowance time. There's no clothing allowance. What do I got to go to school? So these are experiences, characteristics, these policies, this developmental context. By changing that, we can have an impact on that, and we can have a direct impact on some outcomes through this. So for example, if we provide housing, that has a direct impact on economic well-being. You can directly affect some of these things through affecting the developmental context. So that's important to think about because it's very complicated. The fact that you wave your magic wand, for example, and say, oh, we're going to have foster care to 21, that's the beginning of a very long and complicated process. It doesn't, and in fact, a state that hasn't done that before is in for a rude awakening because it's totally different to parent a young adult than to parent a child. What they're doing with their lives is totally different. Their expectations of themselves and of you claim to be a helper, are different. It's just different. And most child welfare systems in this country have really no experience doing that. So I'm going to go through this very quickly because I know you folks know this, but this is a talk I give to broader audiences. But I do want to be clear, we have a child protective system, right? We call it child welfare system. It's not a child welfare system. I alluded to earlier that what it is it's the result of a century-long, more than a century and a half at this point, struggle over what should the role of society be to protect children, right? Back in the mid-19th century, we didn't protect children. They were essentially property of their parents. And in fact, you could look at common law and law in the books. In many cases, killing somebody's kid would get you in less trouble than killing their cow, right? So we've come a long way, but it's all around protecting young people and children from parenting that is beyond the pale, sort of outside the realm of acceptable or normal. We remove them when their safety is threatened, and then we try to find them, a permanent home. And that permanent home just has to be sort of minimally acceptable. Yes, when we have choices, we look at the well-being, what's in the best interest of the child, but at the end of the day, we want to get them out of the system to a safe place. That's it. If we do that, then the system is happy, considers that a successful outcome. We can debate whether that's the kind of system we want to have, but that is the system we have. And as you can see, most of them are in family-like settings. Some are in kinship foster care, some in group care, not so many. The courts play a big role. It's the other thing. I'm sure you're getting some of that. I think we pay way too little attention to that. Not nearly enough research on the role of the courts. I did a study out in Washington with a colleague of mine, Jen Hook, and in a state-run human service system, this is a county-run system here, right? Got 72 courts. They got, I forget how many counties, 40 courts out there, but the agency is a state-run agency. It only had 6 regions. But in one region, the assistant attorney general, essentially be the county counsel here, the person that will file a dependency order on a child, filed on everybody within 3 days, 100% within 3 days. And by the way, there's a lot of places in the country where that's the case. Like, oh, we had the kid care 3 days, we should get the court involved. One of the other regions said, nah, let's wait. Some of these things are going to work out in the first month or not. The parent's not fighting with us. We can use voluntary placement agreements, which you can actually use. You can get paid by the federal government for 6 months for voluntary placement agreements. Very few places do that. We found that in that state, in the first region, the length of stay was 200 days longer on average for kids than in the other region. Because once you open the case to court, in most places you can't send the kid home unless you get the court to act. You filed a dependency petition, you have a dependency order. Even if the agency says, well, okay, it's safe, we got a place. In most cases, the way that the relationship between the courts and the child welfare agency works, you're going to have to wait for a court hearing. Or you're going to have to get the judge to get the lawyers together before the next court hearing, and good luck with that, right? So courts are a big deal. And, the end of this whole process, though, at the age of 18, we got about 10% of kids who exit the system these days are quote unquote emancipated. I always love that term, you know, really? Emancipated to what, from what? I mean, that's kind of weird, like you're emancipated, you're like free of the system finally, you know, and to what? But it's a term we've had for a long time. One thing to keep in mind about these young people is they're much less likely to be adopted or placed with relatives for guardianship and much less more likely to run or age out. So the other thing I want to point out is that if you look at youth nationally, and this is true pretty much everywhere, it's true here when I studied it here, I could be wrong now, but if you look at folks 16 and over in the child welfare system, the first most common exit is going home. Most of them go home. The second most common exit is running away. More common than aging out and emancipating. That's true nationally. It's been true in every state I've ever looked at individually. And because we have a lot of young people who quote unquote run and then we don't find them, or we find them, we can't re-engage them in care. More young people exit that way after the age of 16 than stay around till 18. So that's something for us to think about too. Really, that's really sad. Because again, they were our children and they liked us so much that they ran away and stayed away. Particularly now, in spite of the fact that in a lot of places they could get continuing services, right? The other thing I want to point out here is that most of these young people came in care not as little kids. Most youth who age out of care in this country entered during late childhood or adolescence, okay? And that means that there's a lot of water under the bridge for most of these young people, both in terms of, you know, they've been in homes, quite often troubled homes for many years, and they have family, right? The average age at entry to care of the young people I'm going to start talking to you about in my studies was about 13, between 13 and 14, 13 and a half. So on average, they were home for 13 years. They have a family. We are not their family. We may be legally their family, corporate parent and all that, but if we're not helping them manage those family relationships, we're not doing our job. So this notion of corporate parenting. So you kind of heard, you know, what does policy do? A little bit for me about who these young people are. So the United Kingdom adopted a framework, a policy framework back in the 1990s called Looked After Children. And in that policy framework was the notion of the corporate parent. And they didn't mean like Exxon. They meant like collective parent, really. That's what they mean by corporate, sort of, you know, corporate parent. Roy Parker and some other people, Roger Bullock, June Thoburn, observed that, you know, the state doesn't parent. The best the state can do is try to really effectively and efficiently arrange responsible adults to do that job. That's what the state can do. That's why they use the term corporate parents. It's kind of a collective enterprise. There are three central concepts of this, and I think these would be great concepts for us to organize our child welfare system around, but today we'll talk about these older transition age youth. The one is that care should be consistent with what a responsible parent would provide. So once you've decided you're a substitute parent, our policy should be guided by what would a responsible parent do, not what's the least we can do for these poor black kids, which is unfortunately, you know, how it's framed, I think, in way too many jurisdictions in the country. Well, they're getting better than they would have gotten in Englewood in Chicago, so that's good enough. No, that really shouldn't be the standard. In fact, it is that very few politicians will say that, by the way. Because the reality is most people feel this way. I think most members of the public here, not just in the UK, feel this way as well. Secondly, all institutions that support children and youth in society should share responsibility for this task. The child welfare system is not on its own in this regard. And they're very explicit about that in the UK. They actually have mechanisms. So then the third is local authorities, and that term actually means, it's kind of like county here. This is not the generic term. A local authority literally is a political entity in the UK. It's like a county. Local authorities, they're the ones that run child welfare systems. The federal government doesn't. It's local authorities, including the local political leadership, should take primary responsibility for caring for youth in their community. So there it's the sense that, oh, our community and the local authority are responsible for this, and the political leadership and all these other institutions need to be at the table. So if you look at the looking after children meetings and planning and stuff, it includes folks from the education system, folks from national health, and, you know, child welfare, et cetera. We sort of talk about that, and we have some models of that. But in a policy framework, it's still not the case, certainly nationally, that we have a corporate parenting framework. The Child Welfare Agency ultimately is sort of left to do all of this. And I think in some ways that creates some unintended consequences. Do we really want the Child Welfare Agency to be the mental health agency? Do we really want it to be the health agency, the employment agency, the housing? Yeah, maybe we want it to provide some support, money support for housing. But we have other systems that do these things. So now I'm going to talk a little bit about the evolution of my research agenda and policy. So, and this is not just the evolution of my research agenda. I would say this is in a lot of ways the evolution of our knowledge of this population and how policy and practice affects this population. So back in the 1990s, my work and a lot of other work, well, there wasn't a lot of other work, but what there was describing the transition to adulthood for this population. So just how are they doing, right? The first study I did some work with administrative data looking at how they exit. Do they go home? Do they run away? That's where I observed, wow, more of them run away than are emancipated. That's news to me, even though I worked in a system where a lot of kids in group care ran away, but I didn't know that was my N of 200 or something. And I had data for the whole state of California, looked at that, wow, almost nobody gets adopted, some emancipate, a lot of them run away and we don't get them back. But we did a study here in Wisconsin called the Foster Youth Transitions to Adulthood Study with the state of Wisconsin. And we followed 141 young people aging out of care and followed them till about 18 months after they left and described on average how they were doing. It wasn't a pretty picture. I mean, they were doing poorly in terms of housing stability, homelessness, education, mental health, et cetera. There were some other kind of convenient studies. We had really high response rate. 95% when they were in care, 80% at follow-up, so people looked very closely at those data. Now, it was Wisconsin, but it was kind of the only data we had, really, until the late 90s or into the 2000s. Since about 2000, and I'll come back to policy in a minute, since about 2000, my research, and some other research as well, Peter Pecor and his colleagues at Casey Family Programs have looked at some of the alumni of their programs, mixed in with some other young people in care in the state of Washington, and trying to understand risk and protective factors. So we know some of these outcomes aren't so great. What's associated with those outcomes? Because that helps you figure out what should be the target of your intervention. What might be some of the causes of these poor outcomes, right? So I've been doing that. And then also, a couple of years after that, the federal government started embarking on a period of rigorous evaluation of independent living programs, and I've actually been the principal investigator along with colleagues at the Urban Institute since then on that series of projects, and I'm involved in that right now as well. I'll come back to that at the end of the talk. The enduring question for me, and actually I think for all the people that have been on this trip with me over the years, is how can the state optimally parent these young people, particularly young adults, but also older adolescents, that period. How can we do the best job of that is kind of what I constantly think about in this regard. So how's the policy evolved? As I said, we've had policy directed at this population since I worked in the field. Because I started my group home in 1985, and one of my, I said, when I telling one member of my research team, 2 days ago, we were meeting, and I was talking about, I'm coming to Wisconsin, I used to work there, and started the study back in 1995, and one of my students, Brooke, said, I was 4, like, thanks, Brooke, rubbing it in. But this is even earlier than that, like before most of you were born. But in 1985, we didn't have that policy, but then this law passed in '86, allocating some money, and so I was there in the field as the federal policy changed. We started to have money for independent living services. Somebody who deserves a lot of credit for this is a woman named Trudy Fessinger, who I consider a great mentor for my work. She did a study back in New York City in like '78 and followed young people, much as we did here in Wisconsin. And actually, I to this day use some questions that she asked. Like, I feel lucky to have been placed in foster care. People in the foster care system have my best interests at heart. Some great questions, actually. We've had them now for decades. We've been using them in these studies. And she found pretty bad outcomes back then. And she titled her book, Nobody Ever Asked Us, because she found that actually if you bother to go ask young people in care and tell them this is what we're going to do with it, we're going to share this information, we maintain your confidentiality, you tell us whatever is going on, but we'll share that collectively with the powers that be, they will talk to you. And she found that, and I certainly found that to be true. That book and the advocacy of people working with young people and the beginning of the movement of people advocating for themselves. This is really the beginning. You didn't see many. If you go back and read the transcripts of discussions of that law, there were a couple of young people. Now, we wouldn't have any public meeting. I mean, if you're a politician or an agency manager trying to have a meeting, public meeting about policy in this area, and you don't have young people on the panel, you're going to get crucified in the meeting. There will be people back there saying, nothing without us, about us without us, and rightfully so. Not so much back then, but people in the field were advocating, and we get this law, the 1986 Independent Living Initiative sets aside $70 million allocated to states. Even that they didn't think through too well. They allocated it based on how many kids were in care, all ages, not how many transition age kids were in care. So a state like California that had like the big, crack baby boomlet had like, half the kids coming into care were 3 or under. They got a ton of money for independent living services, even though they didn't actually have as many per 1,000 adolescents in care as some other states like Wisconsin, for example. That's how the money was allocated. So that's, by the way, so those kind of details in policy implementation have a huge impact on whether policy works. It's details like that people don't pay attention to. Oh, it's just based on the number of kids. No, based on the target population you're trying to affect. That's not all kids in care. That's the transition age kids in care. So this money could be used for a lot of things. I call them soft services: outreach programs, training, daily living, education, employment assistance, counseling, case management. The funds could not be used for room and board, specifically prohibited states from using the money for room and board. So what I saw, and what you would have seen, the most typical service was the growth of a cottage industry of life skills training classes. People who would offer life skills training classes to teenagers in care, and maybe it'd be at a community college or an agency that did that. And our county had that, and the county paid young people $5 to go to the meetings, and that was the main thing that money. I would say most places that's the only thing that money was used for years. But it was something, and there was a recognition of the need. So fast forward. We start doing research, including the study I mentioned in Wisconsin. There was also a national study, had a very poor response rate, but it nevertheless documented that a lot of young people weren't getting services and they weren't doing too well. And there were congressional hearings when I was here. The House Ways and Means Committee held a hearing debating what became called the Foster Care Independence Act, the John Chafee Foster Care Independence Act. He was a senator who died, who was interested in foster kids. He died right when this was being debated. But it actually originated in the House, not the Senate. And our study here done in Wisconsin was very influential in passing this law, because we actually had data and showed, they're not doing too well. Maybe we need to redouble our efforts. So we literally doubled the spending, $140 million. Same kind of, you could fund the same range of soft services, but up to 30% could now be used for room and board. So there's a recognition that, wow, some of them might actually need some basic needs to be met. That turns out to be not a lot of money when you start spreading it out over, at that time there were maybe 25,000 kids a year aging out, so you got 75,000 in the 18 to 21 range. Not a lot of money, but it's something. It allowed states to extend Medicaid through age 21. So if you were in the foster care system on your 18th birthday and your state took this up, you would have health insurance through the age of 21. This state never did that. A lot of states didn't do it. I shouldn't say never. It didn't do it for many years because I had repeated requests for data to sort of what would it cost and everything, and every time I did that, later people would say, nothing came of it. So I'm pretty sure they never did it. The law was amended a year afterwards to create something called the Education and Training Voucher, or ETV program, which allocates up to $60 million per year, but it's generally about $48 million that Congress appropriates to fund these education and training vouchers for up to $5,000 a year through age 23. And they can be used for lots of things. They could be used for, books, tuition, pretty much any cost associated with your education. It also creates outcome reporting requirements and devotes 1.5% of this $140 million, so about $2.3 million a year, to fund rigorous evaluation of promising programs. There's literally a paragraph in the law that says this amount of money will be set aside, and this Secretary of Health and Human Services will contract out or, launch, find programs of potential national significance to rigorously evaluate using experimental methods if at all possible. This was actually a big deal. This is the first time in federal social welfare policy where that kind of specific language around you will evaluate these programs and you will use experimental methods, which is kind of interesting. The child welfare field was ahead of the curve there. A guy named Ron Haskins, who was the Ways and Means Committee staff person under Newt Gingrich, the infamous or legendary, depending on which side of the aisle you're on, Newt Gingrich, was behind that. I mean, they had some actually great staff, I have to say. The Republican Ways and Means Committee had some really good people working for them. I don't necessarily agree with the politics of a lot of the legislators, but Ron pushed for that, and I think that was a wise thing on his part. All right, so we have these two laws, right? Things have evolved. We have some research. It's informing this. Mainly it said, we're not doing very well. We need more help. So then out of that reporting requirement, so this says reporting requirement. Now, some of you may have heard of something called NIDed, the National Youth Transition Database. That actually grew out of this law. The law said you got to track outcomes to 21. I was on the federal work group that crafted those outcomes. The Bush administration did not issue regulations for 7 years. Finally, they did, issuing regulations that basically were exactly what we recommended 7 years before that. But it just took them a while because they didn't really care about the law. And now we have it. So basically, states have to track a random sample of young people. All 17-year-olds have to collect data from. They have to track them to 21. Why is that's important for you to know? But it's important because it led to the Midwest evaluation of the adult functioning former foster youth. So the states knew that this was going to get imposed on them. There's going to be some reporting requirement imposed on them. And Susan Dreyfus, who was the child welfare administrator at that time in this state, who I got to know very well because she was a child welfare administrator. She was a child welfare administrator when the state took over Milwaukee County. A lot of things changed at that time. But she was not the administrator when I did that first study, when I started it, but she was when I ended it. And when I ended it, she said, Mark, these are really important findings. The people in the state of Wisconsin need to own this. And we went on kind of a road show. Susan and I went around the state, and they had 5 regional meetings with counties to share the results of the findings, to say, what are we going to do together? What are you in the community going to do for these young people? And came up with a strategic plan for the state of Wisconsin, which was actually a visionary document. For years, other states would kind of go to the website here to get this strategic plan because it was the only place that actually had data and had gone out in the community and talked to people about it. So fast forward to 2000, after this law passed, maybe 5 years, Susan says, Mark, we did that strategic plan. Shouldn't we go out and do another study? Like, I've never had a child welfare administrator, by the way, come to me and say, shouldn't I spend some of my money to learn about whether my services are working, and will you help me do that? But she did, and she said, and by the way, if we're going to do it, shouldn't we get some of the other states to do it so we can learn from each other? I said, you're my kind of administrator, Susan. Let's try to do that. So we went, and she helped me round up the child welfare administrators in Illinois and Iowa. There were actually several other states that came to the initial meeting, but what was telling is the states that sent their child welfare director or like a deputy director, they all were on board. The ones that sent their independent living coordinator, they all had an excuse for why they didn't need to do the study. Every single one of them. Oh, we're going to do that. We're already doing that. We're going to do that on our own. Not a single one of them have any data to this date on the kids aging out of care. So this is my shame on them and don't you be one of them moment, okay? When you become an administrator, CYA is not an acceptable motive for what you do. Covering your ass is just not. And that's basically what these people did. It's like they didn't want to know how the kids were doing because they were afraid it would reflect negatively on them. You want to be a Susan Dreyfus. Susan Dreyfus was willing to live with the consequences of knowing how her agency was operating and then would take responsibility for trying to improve it. And we just need administrators and social workers and managers to think that way. So we ended up with this study, and actually NIDed is replicating this study. I mean, the federal data, doesn't collect all the data we did, but the basic design of interviewing young people before they leave, right when they're on the verge of leaving, and following them later was the design. These 3 states paid for the first 3 waves of data collection you're going to see me describe in a minute. It was the largest prospective study by far of the transition to adulthood in the wake of this law. It was a collaboration between the 3 state child welfare agencies and the research team at Chapin Hall. What we did is we identified all the young people using administrative data who were in care at 17 had entered before their 16th birthday. So in this case, they'd all been in care for at least a year. The states wanted to, look, we have kids, and they were right. They have a lot of young people come into care and leave, right? But the young people who are there for a year at 17, they're pretty likely to age out. Some of them will run away. We followed them anyway, right? But they felt the responsibility. Look, if we've had them that long at this age, we really should be helping them do well as young adults. And if we're not, we want to know that. They had been placed in care, they were abused, neglected, or dependent. Basically their parents were somebody not available to care for them, not because of delinquency. Now, let me be clear. That just means they didn't originally come in care as a delinquent. Doesn't mean that they hadn't had run-ins with the law. A lot of them had at that point. And some of them are what we would call dually adjudicated. So they actually had, probation officer and a child welfare worker. But they originally came into care and became our kids because they were neglected, abused, etc., right? Not because they were naughty. The data that we have, all kinds of data, administrative data, crime, education, etc., but most importantly, we have data from in-person interviews with these young people, and that's what I'm going to share with you today, some of it. So basic study design, back in 2002, 2003, we interviewed 732 young people who met those criteria I just described, a 96% response rate. So again, as Trudy Fessinger says, nobody ever asks us. If you do, we will talk to you. And we were able to follow 4/5 of them at 19, 21, 23, 24, 26. The numbers change a little bit, like, wow, how did the percentage go up when the number of interviews went up? Because people died. Mortality rate, it's not, horrible, but it's not good. I mean, by this time, we had 12 kids that we knew died, including a couple that died in prisons under suspicious circumstances. One prison where they wouldn't let me talk to the kid, and 6 months later, he hangs himself, and I still feel bad about that from time to time. So anyway, we did a good job of following them well past. The states funded these 3 ways of interviews, but because we'd done such a great job of this, we were able to raise money from philanthropy to do 2 more ways of interviews. This is who the young people are across the 3 states, a little more than half female, more than half black, but it was 75% black in Illinois, 25% black in Iowa and Wisconsin. So, very different demographic makeups in the 2 states or 3 states. Illinois was 2/3 of the sample. In Wisconsin and Iowa, we actually sampled and went out to interview all young people who met those criteria I described. And in Illinois, we took a random sample, actually, of 2/3 of the young people because there are just so many. If we had just done a random sample across 3 states and we had 700 or so interviews to allocate, there would have been not many of them in Wisconsin and Iowa. So we said, let's talk to everybody in Wisconsin and Iowa. We'll still get plenty in Illinois. And the state of Illinois, to their credit, said, fine, you can use our $1 million and just don't tell the feds that you're using some of it to interview people in Wisconsin and Iowa. Because they wanted to learn, like this was a collective effort of these 3 states. Interestingly enough, one of the people we saw yesterday, John Toohey, was the person who for years was the person in Wisconsin who I would share all those reports with. And he's still around working for the state. So some great people in Wisconsin. You have some continuity of capacity, as bad as things may seem sometimes. You have some continuity of capacity of people who, many of whom are graduates of this program, by the way, who are still there doing great work. And way too many states I work with, there's nobody like that. So that continuity is very important. So now I'm going to share with you a few selected findings of how young people were doing across some of these major markers of the transition to adulthood, stuff that any parent would be interested in. How's my kid doing in that, right? So this is young women's educational attainment. What I'm going to do is I'm going to share with you attainment and enrollment. They're different things, right? This is how far are they at each age. And so basically this is a percentage that have a high school diploma or GED, 1-year college or a college degree, and we're starting at the beginning of the study at age 17 or 18. We go all the way to age 26. As you can see, by age 21, about 4/5 of the young people, at 19, 2/3 have a GED or high school diploma, about 4/5 have one by 21. This is just noise, right? Because we're interviewing slightly different people at each wave, right? There's no real, hardly anybody's getting a high school diploma or GED after the age of 21. They either have one or they don't, but 4/5 of them have one. So one thing I would say is, quite often we have statistics on only 2/3 of them have a high school diploma. Well, yeah, that's true, or half at 18, but give them some time. 4/5 of them will get a high school degree, and that's good. I mean, it's not great. You'd like to have 100%, but it's better than I think a lot of the earlier studies would have led you to believe. At least 1 year of college. So of these women, by age 21, over a third of them have at least 1 year of college, and by age 26, 2/5 have at least 1 year of college. So why is that important? Only 11% of them have a degree, 2 or 4 year degree. We want more degrees. But having 1 year of college versus not having any college is worth about $300,000 over your life in the labor market. Believe it or not, it's kind of hard. Well, why would that matter? You don't have a degree. So a lot of things. You get skills, you get connections, et cetera. But labor economists look at that and say even a year of college is worth a lot over the course of your life. But again, we only have 11%. But this is kind of misleading because you can look at that and say, well, they're 26, game over. I mean, 2/5 of them have a year, but that's probably all they're ever going to get. A few of these might finish. That's not true. But I'm going to show you the men first. Same story, it's just sadder. They're a bit less likely to get a high school diploma. 1/3 have a year of college by 26 instead of 2/5, and they're half as likely to have a college degree. If I just look at the young men who are not incarcerated, they look almost exactly like the young women. The difference is driven largely by young men's disparate involvement in the adult criminal justice system, which gets in the way of them getting their education. So, but this is why I want you to look at enrollment. So, okay, at baseline, good news. By the way, if you look at demographically matched kids, right? Like if you looked in Illinois at a group of young people, 75% of whom were black and 25% of whom were white, and you looked at what percentage of them were in school at 17 and a half, it would not be 96%. Okay? So one thing the child welfare system actually does, and we could do a better job, but we don't do great with it. There's a lot of things we don't do right with education. For a marginalized population of teenagers, we get them into school. And we don't let them easily drop out of school, right? So that's kind of impressive. When I show that to education researchers, they're like, really? Yeah. Enrolled in school, you can see it sort of, drops down to about 1/4 at 23, 26. But what I want to show here, this is in school or training, this is college. At age 26, almost 1/5 of these young women are still in college, right? That's, the general population's done with a bachelor's program. I mean, some of them would be in graduate school or something, but what's happening for a lot of these young people is they're just taking longer to do this stuff, right? I mean, 30% of them, 30 to 40% of them, by the way, were at least a year behind in school when I first interviewed them at 17, 18. So I'm thinking, I remember when I first found that, I thought, oh, so it should take them an extra year to finish high school, which means they're going to enter college a year later, and then they got other issues, So this is really important because it means there's still potential for a lot of these young women to get a degree, right, or a year of college. What's interesting from a policy standpoint is the ETV program, if you remember my earlier description, it ends at 23. The education and training vouchers, you're no longer eligible for them after 23. There's more young women in college at 26 than at 23. Now, this is not statistically significant, but there's the same, pretty much the same, right? The 23, this is classic, legislative. What do they know? They know their own kids. Oh, yeah. Well, they're really supposed to be done by 22, but, my kid took a little extra, so we'll make it 23, right? Well, these young people need longer than that. So actually, whenever I get a chance, and I've said this to policymakers, even if you don't want to spend more money on this program, why don't you just make it more flexible? Let states use it to 26 or 27 or 28. Because if they got somebody who's going to finish a degree, and the difference between them dropping out or finishing the degree is having an ETV, that's well-targeted expenditure right there. Young men, again, same kind of story. There's still one out of 10 of them, though, are in school, but they're just less likely, and that's driven to a large extent by criminal justice system involvement. Employment. So this is showing what percentage, this is the time we talked to them. I'll give you some other statistics in a minute, but it's the time we talked to them back while they were still in care, 17, 18, then 19, 21, 23, 26. Red is female, blue is male. What percentage of them are working at that time? And generally, the females are somewhat more likely. There's 1 year where that's not true at 19. There's no difference here. Again, if I just look at non-incarcerated populations, the difference kind of goes away. But you can see it's never more than about half employed at a point in time. One thing I want to emphasize here, though, is So 2002, 2004, 2006, 2008, 2009, right? So keep in mind, there is an upward trajectory here, and this is the Great Recession. So the Great Recession affected everybody. Marginalized populations is really bad for them in terms of employment.
Mark, did you control for females with children in this?
Well, we have, no, this is just straight up. I've done that. Yeah, we actually have a paper, Jen Hook and I have a paper looking at employment, and females with children are less likely to be working, and it affects their earnings negatively. Yeah, so particularly this group. I mean, it's a little tricky because some of these females are having kids out here. You'll see when I get later. I'm going to talk about subgroups a bit, which sort of, this is average, so I should have said that. Remember, this is average. Averages are dangerous, I mean, they're useful. You got to share them, but you want to go beyond them, and we will. But one thing I want to point out is this is at a point in time, pretty much, in their 20s, about 3/4 of the young people were employed at some point in the year. So point in time can be a bit misleading, but that means 1/4 of the young people, every time we talk to them at 19 or 21, 23, 26, hadn't worked at all in the last year. 1/4 had not worked at all in the last year. And even among those who worked at 26, average earnings was about $14,000. Now, when you adjust for family size, about a little over half of these young people are living under the federal poverty line at age 26. Family formation. So this is young women. I like to focus on a couple of things. Living children and resident children. Married is kind of misleading. And most of those are cohabiting, not married. There's not a lot of marriage in this population at this early age, and that's not surprising. It's not a lot of marriage generally. But you can see that half the young women by the age of 21 have a child. That becomes important when you start thinking about extending foster care to 21. Then unless we somehow magically come up with pregnancy and parenting prevention programs, you better be ready to parent. Half the young women you parent are going to be parents by the time you're done parenting them, if you're thinking like I do as a corporate parent, right? It's important to keep that in mind. Then this is resident children. So this is, okay, these are the percentages that have at least one child, and these are the percentages that have at least one child living with them. You can see they're very similar. So 65%, 72% of the young women have a kid, 65% have at least one kid living with them. And in fact, the other way to look at it is how many of the women who have a child have at least one child who's not living with them? And that's 1/5. So 4/5 of them are living with all the children they've had. So now that's still higher, 1/5. That's higher than the general population, but it's not what I think a lot of people would think. Oh, all the kids are getting taken away and go into foster care. And even of this 90% of women who have at least one non-resident child, about 1/3 of them are, from what we can tell, probably in some kind of out-of-home care. The other 2/3 are living with the father or some other relative. They're not all going into foster care. Now, very different story for the young men. They are less likely to have children. That's not surprising. That's true in the general population. Mating, generally young men are a bit older than the women that they're, mating with. But still, 30% of the young men will have a child by 21. Half will have one by 26. But these do not look like those, right? 2/3 of the men who have children have at least one non-resident child. 2/3 of the young men who have had children have at least one child who they acknowledge fathering who's not living with them. That's a problem. That's a problem. This is not the only population that has that problem, but it's a problem. And I'm going to come back in a minute to, at least we have some evidence now of one thing that might actually increase father involvement with those kids. Criminal justice system involvement. So we ask, have you been arrested? What we typically do, we have administrative data on arrests, we have other things, but actually the self-report data is very close to what you get from official records. And official records have some problems because if the young person moved out of state, I don't have official records in that state. So it gets tricky. So I prefer to share self-report data. And this is, now we're saying, since the last time we talked to you, so here it would be, we talked to you at 17, 18, now we're talking to you at 19. Have you been arrested, convicted, or incarcerated? Let's focus on incarceration. So since between 17 and 19, 11% of young women were spent at least a night in jail or prison, went up to not quite 1/5 between 21 and 23, and that declined to 10% between 23 and 26. That's still very high, compared to young women in the general population. Young women are much less likely to be involved in the criminal justice system than young men. That's still very high. But it's just truly saddening to see what has happened with these young men with respect to their involvement in the adult criminal justice system. Now, before I get to this, let me say, at any point in time, we never had more than 14% of the young men incarcerated. That's still pretty high, 14, 15%. But that understates their involvement with the criminal justice system, because you can see, looking at incarceration, the percentage of young men who say, I spent at least a night in jail since the last time I talked to you, so in other words, kind of over the last 2 years, ranges from 1/3 to 2/5, and even more than 2/5 here. Even at age 26, 4 out of 10 of these young men have spent at least a night in jail in the last 2 years. Convictions, kind of important. If these are felony convictions, a lot of them are. But by the way, very few of these are violent crime, relatively few. Most of them are property crimes, drug crimes. If you have a felony conviction, I think it was a great article in the New York Times about what percentage of men, generally, in this country are seriously impacted by having a criminal conviction and their ability to get a job. Because there are all those check boxes. Have you been convicted of a crime? And it's very, very easy for employers these days to check that. You have virtually no privacy around your involvement with the criminal justice system in this country. And, they just don't hire you, right? Even arrests. A lot of places you get arrest records. They don't even know if you're convicted. You were arrested. They can search on that information. I can do it right now here in the state of Wisconsin, right? And so, these folks have a hard time. If they have a conviction, they're ineligible for all kinds of government aid, financial aid. So it's even though these are not, for the most part, serious criminals by any definition, it has an impact for them. So summary, again, these are averages. Early adult outcomes posted. This is the Dr. Doom part of my talk. It gets more optimistic because there are actually things we can do about it. But I do think it's important to get out there what we know on average about the outcomes, right? They're generally poor. They vary by gender, with males faring worse generally. But despite a sobering picture, many young people leaving the care of the state do well. And I'm going to share some information about that with you in a minute, because we're breaking this out into subgroups, and there's a couple of subgroups that are actually doing pretty well. So, all right, they're not doing well. What's a concerned parent, policymaker to do about these poor outcomes? So the nice thing about this Midwest study, and one of the reason early on it got a lot of attention because we didn't have good data other than Wisconsin on how young people were doing. But mainly these days, when I get asked to go give talks to legislators, I was here talking to legislators just a few weeks ago, it is about the benefits of extending foster care to 21. Why can we say something about that? Because the ability of foster youth to remain in care beyond age 18 varies across states. And in our study, Illinois was the state that for the longest period of time had routinely allowed young people to remain in care until 21. Iowa and Wisconsin, however, did not. In Iowa, you could stay in care past your 19th birthday if you were going to graduate from high school, and the judge and the agency and everybody said that was going to happen. We had, out of the 60 people in our study, I think 4 of them were in care for like a month or two past their 19th birthday for that reason. In Wisconsin, the exception was not for that. The exception was for pregnant foster youth. Now, why do you think Wisconsin would make an exception to let you stay in care past your 19th birthday because you're pregnant? The baby might come back into care?
Yeah, if the mother wasn't supported.
Yeah, that wasn't the argument. That's a better argument. that might make some sense. No, it was protect the unborn child. The fear was that if we didn't make that policy exception, some of these young women would have an abortion. We didn't find any who stayed in care after 18 in our study. But no, that was the policy. That's how distorted policy discourse in this state was around extended care. That, oh yeah, we'll make an exception if you're pregnant, and the argument was because we certainly don't want you having an abortion. You stay in care until you have the kid, and then we'll decide whether you can keep the kid or not. So this policy experiment was, from those of us who are evaluators, like it doesn't get any better than this, because policy differences quite often don't drive behavior as much as this one does, right? So what this shows is for Wisconsin, kind of magenta, Iowa, kind of light yellow, and then this kind of light blue is Illinois. It shows what percentage of young people in my study in these 3 states exited. Here would be 17 or before their 18th birthday. This would be between their 18th and 19th birthday, and this is 19, 20, 21. And you can see that basically in Iowa and Wisconsin, everybody was gone with the exact, again, this 10% is like 4 kids basically, except for a handful of kids in Iowa, and they were gone within a month or 2 of their 19th birthday. However, in Illinois, over half the young people in my study who look the same, they're same criteria for sampling them. They're all in care at 17, they've been in care for a year, et cetera. Over half of them are in care past their 20th birthday, and most of them stay till their 21st birthday. Big difference, right? And in fact, this translates into an average age at discharge from care, these older adolescents, 17-and-a-half-year-olds, of 18 basically, just under 18 in Wisconsin, Iowa, almost exactly the same, and 20 in Illinois. So this is a powerful policy impact. We like the term exogenous effect, right? It's not the kids that did this. You can't explain this away by differences in kids. And we analyze that. We estimate fancy models. But this is such a huge difference that this isn't because all the kids in Illinois want to stay here. 2 years difference. And it also gives you a sense of this is a big, powerful thing, right? On average, the young people in Illinois got 2 more years of care than the other kids. So what do we find out of that? So here's the summary. I'm summarizing a whole bunch of papers that we've done over the years. And we're still working on this. I'm redoing the housing analysis because I think the housing, our analysis of homelessness, I think, is flawed. I'll come to that in a minute. So what have we found in terms of this policy difference? We found that allowing foster youth to remain in care until age 21 is associated with the following outcomes, all of which are positive. We found no negative impacts of this. 1, increased likelihood of obtaining post-secondary education. I mentioned not a lot of completed a degree, but many remain in college. And generally, the young people in Illinois are 2 to 3 times more likely to achieve any post-secondary achievement marker you want to talk about. A year in any college, a year in college, et cetera. Degree, it's a little tricky because not a lot of them have, so you don't have statistical power. But if you look at the estimates, they're pretty much exactly that, twice as high in Illinois. In spite of the fact, by the way, that the kids in Illinois, 75% of them are black. 75% of the kids here in Iowa are white. College outcomes are very different for blacks and whites in this country, and they do not favor blacks. Increased earnings, particularly later on, those increased earnings at 23 and 26 are mediated by college. So if you look at earnings and employment at 19 in Illinois, they're actually less likely to be working in Illinois. That's because they're in college, like many of you were. Maybe you work part-time. And then you get out to 23, 26, the young people in Illinois are earning more money. Delayed pregnancy. Young people remaining in care were about 2/5 less likely to get pregnant between 17 and 19 than those who had left care. Reduced crime among females. We see about a reduction of about half in the arrest rate. Now, we don't see an impact for males, and a lot more males are involved, but nevertheless, that's good. And delayed homelessness. We see that young people are less likely in Illinois to become homeless before the age of 21, but then if you look all the way to 26 and were people homeless at least once, there's actually no difference. The problem with that analysis is my good colleague, Amy Dworsky, who was here, got her Ph.D. at the University of Wisconsin, has led that work, is that it doesn't take into account how many times you've been homeless and how long you've been homeless, right? And so I'm beginning to reanalyze those data, and it's not public yet, but I think there's actually a big difference between how long and how often you're homeless associated with extended care. Increased fathers' involvement with their children. So the other thing we see is that young men who are in care are more likely to be in contact with their children, and we see that that's mediated by their relationship with the mother. That the young men who are remaining in care have better relationships with the mother, and that they are also, therefore, they're associated, more likely to be involved with their children. And there's a lot of research that shows that's one of the major obstacles to non-custodial fathers, is that the mothers at a certain point say, I don't want you involved. And we believe that's because people in the system help these young men negotiate those relationships. And then once you're out of the system, you got nobody to help you negotiate those relationships. The other thing is that allowing foster youth to remain in care until 21 increases the likelihood of their receiving independent living services. Now, I'd like to know more about what is an effective independent living service, But the policy is you're supposed to be providing independent living services through age 21. And interestingly enough, in Illinois, even though Illinois does not have some panacea child welfare system, at 17 and 18, we ask a series of 40 questions across all kinds of life skills, employment, education. Did somebody help you apply for financial aid? Did somebody help you learn how to balance your checkbook, et cetera, right? All the way down. Young people in Illinois and in Iowa and Wisconsin were actually a bit more likely to answer those questions yes than the young people in Illinois. They were getting more services. After 17, 18, it's night and day. The young people in Illinois are getting a hell of a lot more services than those in Iowa and Wisconsin. And it's not surprising. They're still in care, they're engaged with the system, et cetera. So, out of this study, now, again, I don't want to simplify that. I mean, there's a lot of advocacy. At this point, you have groups of foster youth, California Youth Connection, Foster Club, organizations like that are starting to use my research, and, of course, they have their own stories. And they're saying, look, this is ridiculous that we get kicked out of care at 18, and people like Alfred Perez testified before Congress. He became a doctoral student of mine at the University of Chicago, and Julie Henley's as well. But this study was instrumental in this. Again, I was asked to testify before the Ways and Means Committee, shared these kind of results on the differences between Illinois and the other two states. And in October 2008, you see the Fostering Connections Success Act of 2008. Those of you might connect that historical period, what was happening in October 2008, Henry Paulson was on his hands and knees going to Nancy Pelosi and saying, we need $1 billion or the whole world financial system will collapse. Okay? And yet, Congress creates a new entitlement program for youth aging out of foster care. Overwhelming. And there were 5 no votes in the House. Okay? And I think this speaks to, one, these folks understand it's just not normal to kick young people out the door at 18. And we now had data that said the state, the government, actually can do this well enough that it makes a difference. That was very important to have, by the way. It's one thing to say this would be the right thing to do, but you got a lot of people, a lot of the public and a lot of people in government or politicians who say, well, that might be nice, but the government's just incompetent. It can't do anything well. Why would we spend money on that? Well, it was clear that Illinois is spending money on this, and it was benefiting the young people. In fact, we've done a benefit cost analysis that showed that for every dollar spent, the society and the young people get about $2 back in lifetime earnings just associated with the education benefits I talked about. Not even taking into account, reduced homelessness, pregnancy, any of that stuff. So that was very important to this. And one of my cherished possessions is an email from Nick Gwynn, who's the chief staff person for the Ways and Means Committee, saying, we could not have passed this law without this great study that you and your partners in Wisconsin, Iowa, and Illinois did. So those child welfare administrators get a lot of credit for being willing to scrutinize their work. As you can see, it was not a pretty picture. For years, the media basically said, oh, look at this, it's horrible, these kids are starving and homeless and everything. But at the end of the day, those 3 states knew what happened to young people in their care. None of the other 47 did not. And we made the case for this law. So the law, I think, is developmentally appropriate. It basically says you can stay in care, but you got to be in school, including high school or post-secondary ed, participating in a program to help you get employed, working at least 80 hours a month, or incapable of doing these things due to a medical condition. And the Obama administration, to their credit, is to define that very broadly, right? Like you have a mental health disorder, substance abuse problem, disability, all those things, right? They would get in the way of work or school. You can stay in care, and hopefully the state will help you still try to work and go to school, right? But that's kind of appropriate. I think my daughters should be doing one or more of those things. I don't have no problem with the state saying, oh, these are things you ought to be trying to do. We're going to help you if you can, because you're schizophrenic or you're, really struggling with a substance abuse problem. We're going to help you with that problem, but we're also going to want to move you in the direction of doing these things, right? The foster care independence program remains the same. It's still there, ETVs, et cetera. But this state option implies great interstate variability, and I'm not going to talk about it today, but California is one of the first early adopters of extended care, much to my, pleasant surprise. And I'm studying their implementation of extended care there. They've invested. They say, we want to know how this is going. We want to hide it all. We've extended care. It's a big investment on our part. We believe in it conceptually and in terms of our values, but we want to know if it's going well and learn from research. So we're doing that. All right, so now we know, I think, it's still an option. Only 20 states have extended care to 21. This is not, this state has done it, but for a very narrow population. Folks who have an IEP, you know, can finish high school. That's it. You know, like once you're done with high school, you're done. And if you don't have an IEP, no extended care. But 20 states have done something. Wisconsin's one of the narrowest ones, but it's one of those 20. But so let's just say, for the sake of argument, there's still a bunch of states that have now said, you know what, we're not going to abandon young people at 18. But then they quickly confront, oh, well, how do we do this? You know, like, how do we do this well? We don't know how to do this, right? I think one thing to start looking at is go beyond those averages. So understanding this fancy word heterogeneity, you can use the term diversity, but that carries other connotations. But understanding that, you know, these young people are all individuals, right? And they have constellations of characteristics and strengths and needs, et cetera, as we know from, you know, social work practice generally. We've done some things, I'm going to simplify this pretty quickly. We've used some fancy statistical methods to see whether young people hold together in fairly discrete and different groups on some of these major markers of the transition to adulthood. And the one I'm going to talk about today is one we did when the young people were 23, 24. And basically we used indicators of their functioning in sort of major transition domains. So living arrangement. Are you living on your own? Are you sharing, like a lot of young people do? Or are you essentially homeless or institutionalized, like really marginal, problematic housing arrangement? Educational attainment. No high school, some college. Employment, are you employed or not? Do you have children? And if you have children, are they all living with you? Because that's different, you know, if they're not. And if you had a conviction. Unfortunately, that is such a, normally you wouldn't use that when you're doing a late class analysis of young adults because it's not that frequent, but it is in this group, so we included that. And what we find, to make a long story short, is 4 very distinct groups of young people. And I'll describe them for you briefly. So the largest group is a group we call accelerated adults. These young people have all finished high school. Half of them have some college. 40% of them have kids, but all the kids pretty much are living with them. They have very few non-resident kids. They don't really stand out in terms of other areas of functioning, not a lot of mental health problems, not certainly low rates of involvement with the law, et cetera. But, you know, they're still not rich, right? I mean, they haven't finished college. A lot of them are working, the highest rate of employment of any of the 4 groups. But they've basically avoided serious problems. When we ask them, we ask all the young people throughout the study, do you feel like you've had to grow up? I have a series of questions we call the adultra questions. You know, do you feel like you had to grow up faster than other young people? Or are you more independent? This is a group most likely say, yeah, I really had to grow up fast. And they've done pretty well in that context. But they're aware of the fact that this was a tough row to hoe. And if you think about the kind of help they need, for the most part, some of them need counseling, et cetera, but for the most part, it's not intensive interventions around psychosocial problems. It's like they can use some help with childcare. They could probably use more help going on to school, et cetera, right? The second, I'm going to get to the second group. It's not the second largest, it's the third largest, but it's, you know, still pretty big. Emerging adults. They also have all finished high school pretty much. Half of them have gone to some college. They're less likely to be working this group. This group actually most overwhelmingly living in their own place. This group not. They're more doubled up, living with friends and other folks. You know, some of them have kids. Maybe 2/3 of those kids are living elsewhere, but not in foster care. They're living with relatives, the other parent, whatever. These look like Jeff Arnett's emerging adults. These young people look a lot like my daughters. They're doing okay. They've definitely, their lowest rate of involvement with homelessness, crime, any of that kind of stuff. You know, they're taking their time, figuring out what they're going to do, avoiding trouble. Again, they could probably use some more help with their education, et cetera. $5,000 a year is not a lot, ETV, and once you're 23, it's gone, you know. But these 2 groups, the averages belie it, right? I mean, I showed you averages. 100% of these folks graduate from high school, and half of them have a year of college, right? So they're doing pretty well in avoiding problems. The other 2 groups, not so much. Second largest group we call struggling parents. They are largely young women, about 3/4 of them young women. They all have kids. Vast majority, only about 10% of them have non-resident kids. Vast majority are still living with their kids. But when you start looking at things like education, only 1/3 of them have a high school diploma. The lowest rate of employment, I think 1/4 or 1/3 of them were employed. 3/4 of them were relying on some form of public assistance. These are young women largely some young men, who had children early on, and that has dominated their experience. It has made it very difficult for them to achieve some of these other things that these young people have been able to achieve. And they're going to need different help than these young people are going to need. So again, one-size-fits-all policy or practice is not going to work. That's kind of why I want to throw this out there. And then the last group is a group we called Trouble and Troubling. We were struggled for a long time to come up with a name. And actually had some young people push back. And I sort of stuck to my guns, and I'm glad I did at this point. So these about 80% of these young people are young men. They all have involvement with the criminal justice system. They have education outcomes a little better than this group, but nevertheless, very few have any college. Only 10% of them were working at the time we talked to them, 23, 24. They are a group most likely to have had mental health and substance abuse problems way back at 17 and 18. And we ask a series of questions of these young people along the way, how prepared they feel to be on their own. This group at 17 and 18 by far was a group that said, please don't send me out on my own, I'm not ready. Their answers in the preparedness realm across all the domains were by far the lowest. So these are young men who have serious emotional, behavioral problems. We knew that. You don't have to be a rocket science to know that back at 17, 18. And you probably could have predicted that they were going to have a hard time of it. This is a group that I think represents, a lot of them are young people who are going to need a lot of help for a long time. So the idea that even 21 is going to be it is probably a foolhardy assumption for some of the young people aging out. So what are the implications for policy and practice? These distinct, I've already started talking about this, these distinct subgroups really call for targeted, developmentally appropriate policy and practice. Large groups, or those two groups, kind of need help with school, child care. Some of them will need help still talking about their, the trauma histories, et cetera. But these are not folks who need a lot of really intensive intervention. They need interventions that are probably more concrete resources, not as heavy touch. The parents as a distinct subgroup definitely need help early and often. Like we need to earlier on say, whoa, if we don't do something, these folks at 23 are going to not have any work experience. They're, will not even be finished high school, and now they're going to be 23 with a bunch of kids. And I haven't looked at it, but I'd be surprised if they keep those kids indefinitely, right? And then of course this group, Trouble and Troubling, needs a lot of help, arguably for a long time. And the other thing that this breaking things into subgroups helps you understand is why I and others feel so strongly that a variety of public systems have to be held accountable, particularly if you're going to let young people stay in care into adulthood. The public mental health system, the housing systems, the child care systems, all of these other institutions have to take some ownership of this population. Otherwise, the Child Welfare Agency is reinventing a wheel in a very inefficient way. And it won't do that, right, in most cases, because it doesn't make any sense for it to do that. So, and I can give you lots of examples. I don't have time today, but hopefully I'll get done in a minute here so we can have some conversation. But I can give you lots of examples of where these public systems actually go out of their way to avoid serving these young people. Housing's a great example. Public housing agencies, even though for a long time, Section 8, for example, said, yeah, youth aging out of foster care, that's a target population. They run screaming from that population. I mean, they'd much rather serve old people who don't have a lot of disabilities. I mean, and there's a long waiting list, so these kids are never going to get in. And we made some efforts. We set aside Section 8 vouchers specifically for this group. I mean, that's a few hundred nationally, right? So we actually need these other institutions. We need post-secondary ed, and that's a place where we have some success stories. California, Guardian Scholars Program, you have a bunch of campuses with on-campus support programs for foster youth that are there. That's kind of what we need, and we need that across these institutions. Unfortunately, right now, we see those partnerships more for the highest functioning young people, the ones going to college. The ones in trouble with the law, had kids early, not so much. What about evidence-based practice? So do we have, that's the hot term, right, for a long time now, evidence-based practice. Do we have evidence-based practices or programs or interventions in this independent living world? Not much, but it's getting better. So we have a handful of longitudinal studies like mine that have identified risk and protective factors. A lot of those are fairly obvious from the general literature. You find the same thing, right? So prior education, employment while you're a teenager, addressing your mental health problems, whether you have kids, whether you have connections to supportive adults, those are all important things, and we should pay attention, and our practice should be directed at those. We have some qualitative studies descriptive studies that tell you some other things. Like, so for example, a lot of these young people they begin to construe the notion of family differently than, although I have still a lot of people once they get away, a lot of young people once they get away at college, they start thinking, yeah, I have my family at home, and then I got my family I'm making here, right? These young people are very likely to do that for reasons that are fairly obvious. A lot of them have strained relationships and no relationships with their family. And then we have some, what I would call promising programs that have at least really scrutinized their own work. So again, these college success programs, I think, there's a lot of evidence within those programs, kind of good news. They have not been rigorously evaluated, however. So we don't know. Maybe those young people who participate in them would do fine without them. Asset development programs, the Jim Casey Foster Youth Opportunity Program, it's a match savings account program. They've collected a lot of great data showing that young people will save again. I don't know whether the young people would have saved just as much without that. But nevertheless, probably should evaluate that. Some transitional housing and just transitional living programs. So I am actually the principal investigator on an evaluation done by MDRC, the New York evaluation firm, of the Youth Villages Transitional Living Program. Stay tuned. That is good news. Good news. This is an intervention that actually has impact, and we will be releasing that in May. And then there's some mentoring programs that have shown some promise, but again, not in rigorous evaluation. So the bad news, generally, is we have not rigorously evaluated things. There was a review of studies done back in 2006 by Paul Montgomery, a guy at Oxford, around the world, basically said there's not a single, at that time, there was not a single rigorous evaluation of an independent living program using those rigorous methods that shows an impact. And then there was some quasi-experimental method, and he basically said, look, you can't draw any conclusions from that stuff. Since then, we've had some other studies. One I just mentioned to you that will be out soon. But the federal government funded under that 1.5% I told you about in Chafee, they funded a series of things, first called the Multi-Site Evaluation of Foster Youth Program. Right now it's called the Next Generation, Chafee Next Generation Evaluation Agenda is what it's called. And wisely, we are not evaluating anything right now. We're actually trying to work with the field to identify programs that might be ready to be evaluated with some help. I would say the main conclusion we found 4 programs that have been around for a while: life skills training, classroom-based life skills training, a tutoring mentoring program, employment support program. None of those had any impact. Zero, nada. There are reasons. It's actually interesting why they didn't have any impact. If you're interested, we can talk about that in a minute. The Massachusetts Adolescent Outreach Program, which is an intensive case management program. So in addition to your caseworker, you got an outreach worker, no more than 16 young people, and they worked exclusively on transition issues. And that program did have an impact on college in particular, the likelihood that young people went to college and persisted in college. But it also had an impact in Massachusetts on whether they stayed in care or not. And in Massachusetts, you could only stay in care if you went to college. So we have a bit of a chicken or egg issue here, right? The program did succeed compared to the control group in getting people to stay in care and go to college. But would the program work here in Wisconsin where you don't get to stay in care? Can't really say. Probably not, but you can't really say. So limited evidence there. What's interesting to me about that program is an intensive case management program. That's what the Youth Villages program that I told you about, stay tuned, is. So we begin to get a story here that young people this age need a lot more intensive support on a sort of day-to-day or week-to-week basis than we're typically providing through case management in the child welfare system with once-a-month visits. Bottom line is that too many interventions and programs are poorly targeted, have poorly developed logic models, and/or are not intensive enough to influence outcomes for youth making the transition to it. This is our main conclusion of after doing this study, because we visited 28 programs, talked to program directors of many more, was that the field is in the Stone Age in terms of like how it actually thinks through interventions, like taking a logic model. What's the outcome you want to achieve? What's the population you're trying to serve? Why do you think what you're doing is going to have an impact on that population? How are you going to effectively make sure that you're serving that population and not ending up serving somebody else that doesn't have those criteria? Most people we talk to, they look like a deer in the headlights when we ask them that question. And yet they're running programs, many of which get a lot of money, hundreds of thousands or millions of dollars in some cases a year. And again, I think that our field bears the responsibility of being able to answer those questions. What's the population we're trying to serve? Why are we serving them? What are the inputs we're providing? What's the theory, whether it's big T theory, social science theory, or in our own head, what's our theory about why this is going to make a difference? And then are we keeping track of those inputs? And are we even looking at outcomes, let alone rigorously evaluating? And so federal government wisely backed away from let's go do some more randomized controlled trials and said, let's find people in the field who think they're at the cutting edge in various areas, education, employment, pregnancy prevention, and let's get those programs to the point where they actually can be evaluated before we evaluate them, because we'll probably find out they don't work if we evaluate them before those other steps are in place. So let's get serious about learning from all this experimenting. I'm sort of infamous or famous, depending on whether you like this statement, of saying that the public child welfare system in the U.S. is a 150-year-long experiment on children and families with no human subject protections. I'll repeat that. Child welfare system in the U.S. is a 150-year-long experiment on the most vulnerable children and families in our society with no human subjects protections. I mean, the stuff we do on a day-to-day basis in the child welfare system, because we believe it works, right? And we don't find out whether it works. We are experimenting all the time. All these new ideas, way too infrequently do we actually evaluate whether our assumptions are accurate. And we could have a long discussion about, because I'm a bit of an amateur historian, all the ideas we've had over the years that were going to help people that we then find out later, oops, didn't help, might even hurt in many cases, right? So we need to stop doing that. I've got this CalUse study in California where we're studying young people aging out, and we're getting ready to go back and interview. We interviewed them already. Again, 96% response rate. We're going to follow up at 19. We've got linked caseworker service. We're asking the caseworkers of these young people, how are they doing? What services are you providing? How often you visit them? Amazingly honest, actually. The good news is I think people in the system all are there for the right reasons, pretty much. They're doing the best job they can. They care. And we got a 90% response from caseworkers in our earlier survey. So National Governors Association has a working group on extended care. There's this National Youth and Transition Database I mentioned. One thing we did learn from the multi-site evaluation is that rigorous evaluation is possible. We did it. We randomly assigned young people. They participated. It can be done. We just have to have the will to do it, right? And we need to do, the steps before we do that to make sure that we're evaluating things that are ready to be evaluated. And it's also ethical. In fact, I would argue it's implicit in what I've already said. It's unethical not to do that. Spending way too much money without knowing that it's helping people. So it's time to stop treating foster youth as guinea pigs in an ongoing experiment with no human subjects protections. Is sort of my last comment. And that's most of the collaborators I've had, a lot of folks over the years worked with me. This person is a graduate of the doctoral program at the University of Wisconsin. Is now a faculty member at Chicago. Amy Dworsky is a graduate of this doctoral program as well. Andy Zinn started work with me. He's a graduate of this program. So we've got a lot of connections to Wisconsin on this list as well. So we've got a few minutes. Comments, questions? What do you think? What would you like to know more about? Maybe you want to know less about, but.
I'd be very interested if you know the type of environment, the living environments, and especially, where it's working well. Because what I've seen with kids who have the option to stay in longer, they're choosing that students because they didn't like their foster grant, they didn't like the rules, they didn't like the group home, they didn't like all the other things. So how has that been? Because it's very different.
That's a great question. So if people didn't hear, the question is, so what are the living arrangements like for young people who stay in care as young adults? And how's that working, right? So one of the things that there's a page in the report at age 19 from the Midwest study that compares youth still in care, which is pretty much Illinois. At that point, we didn't out the states in those reports, to the ones out of care. And what's really telling is that baseline, when they're 17, the placement arrangements are very similar in 3 states. Kinship foster care, non-relative foster care, group care. At 19, half of the young people in Illinois are living in what they called supervised independent living settings. Now, what are those? So first of all, let's acknowledge what should be obvious, maybe isn't. That's pretty normal, right? You get out to 19, and actually very normal, because I said about half of young people, if you look at 19-year-olds, almost half of them by that point are not living with one or both of their parents. So they're not living in a foster home, right? You know, the equivalent of a foster home. They're living in some setting with other young people, right? And so in Illinois had been doing that for a long time, and they had a range of those options, right? They had some where some agencies would actually own a facility, and they'd have an apartment building, and the young people would live in that apartment building. Others would have an arrangement with landlords. They might have a lease, but they had scattered site apartments. A lot of different ways of arranging that. They also had a lot of young people living in dorms. I mean, if they went to college, they live in a dorm, right? I like to say to lay audiences, when I use the term supervised independent living setting, I can see they're like, I don't know what that is. I go, oh, was your kid ever in a dorm? That's a supervised independent living setting, right? There's a resident assistant, their food is organized for them. You know, that's highly supervised independent living, but they're sort of independent, right? So there's a range of those settings. That's a real key thing to making extended care work, right? Is acknowledging that young people increasingly want to live independently, and yet we need to support them in that, right? And so that's actually right now, if you talk to people in California, in my study, it's a major theme of our study is, you know, we passed a law, and they're 2.5 years into implementing this, right? And they still don't have nearly enough of those arrangements, right? And some of those arrangements, if you start thinking about the subgroups, right, you need to have some that work for parents, right? And then you need to have some for the young people who are now young adults who are in residential treatment. And now they're beginning to figure, like, I'm an adult, I can do whatever I want. I don't want to live in residential treatment. I want to be in the community. And actually, Kaleidoscope, which is one of the, maybe the first wraparound service models in the country, in Illinois, they operate you know, a program for young people who have aged out. The DCFS pays them with people with serious mental health problems. And it looks a lot like the program of assertive community treatment here. I mean, it's like they find a place for them. It's intensive supported housing, basically. You're visiting a lot more than once a week even, right? And California is just, they have a funding mechanism to do that, but not all. It's a county-run system. A bunch of counties say, we're not going to pay for Transitional Housing Plus. They have a program. So you got a bunch of counties, particularly rural counties, like, we're just not going to do that. And so that's a big issue, right? But I mean, I think that there are lessons to be learned out there. There are folks who have been doing this for a while. And the bottom line is we want developmentally appropriate arrangements. And for young adults, that means a lot of them are not going to be just like a foster home because, yeah, they don't want to stay in the foster home. Some of them do. And in places that have extended care, they can. I mean, the foster parent gets paid. And actually, a lot of the foster parents have been interesting, get pretty creative. They're like, well, I'm getting $800 a month because it's a teenager, right? And then they'll say to the young person, you know, I'm going to keep, now that you're an adult, I'm going to keep $600, but here's $200, but it's going to go towards savings for whatever, you know, or what, well, let's talk about what you would use that money for, right? So the young people feel like they have some more agency. So it's interesting, but yeah, it isn't. The regular foster home situation is an option, but not adequate.
Can you talk more about how the independent living services don't have an impact?
Sure. So you know, thanks for asking that question, actually. I don't want to say, I want to rephrase what I said. I wouldn't say that we know that independent living services don't have an impact. I would say that we know that several kinds of independent living services, a couple of which are pretty ubiquitous or used a lot, have been evaluated and not shown to have an impact. That's different. So sometimes people have said, Mark Courtney did this research, and he shows that the $140 million spent at the Chafee Fund is useless. I never said that. I just said we haven't evaluated the distinct things we're using that money for to know which of them are effective and which are not. You know, I actually believe that money is benefiting young people in many ways, but we need to be more thoughtful about how we document that. So out of the 3 studies that found no impact, right, where we did good rigorous evaluation, why didn't they have an impact? 2 of them will go quickly. So one of them was an employment program. It was a light touch employment program. It was like a county, Bakersfield, it's Kern County in California, said, you know what, these young people, they're going to end up working in the service economy. A lot of them don't have a lot of skills. That's a lot like our TANF agency. Our TANF agency helps, you know, parents without a whole lot of skills. Let's take a couple of our TANF workers who like the younger adults and move them and create a job program for young people in foster care, starting at 16 and up. And it's a light touch program, right? Because that's what TANF programs aren't beating the pavement and chasing after the people, right? Like you have to come to them. But that kind of made sense. The folks in the federal government that were funding us, they're also over the TANF program. They said, oh, that's a great idea, TANF, yeah. Well, the problem is a light touch program doesn't work for teenagers, particularly 16-year-olds. Like a lot of them don't necessarily need a job. They may show up at 18, oh my God, I'm starving. But again, the services provided were sort of a monthly newsletter. All of them got that. But only a quarter of the people in the experimental group got as much as actually in-person meeting. So the lesson there is if you want to run an employment program for this population, it needs to be a whole lot more intensive than sort of if you build it, they will come. They won't, right? So that's the lesson of that evaluation. Tutoring mentoring program, LA County, big program, spending millions of dollars on it. The idea is a lot of kids, young adolescents in care are behind in school, and we need to help them catch up so they can finish on time. So there's a program there that if you were a social worker, a foster parent, or a young person, and you're behind in school, you could get referred to this program, and they would assess you. They would basically test your abilities in reading and math. And if you were 1 to 3 years behind, they would assign you a tutor who would go into your home, provide home-based tutoring. Okay, kind of makes sense, right? Seems like a good idea. We have some evidence for tutoring, but actually the evidence for tutoring suggests if you don't get at least 50 hours of it, there's really no benefit of it in general. That's what the studies say. So we evaluate this. This kind of makes sense. There were two issues, though. Three issues. One, a lot of the folks they assessed, this is targeting, were actually outside of that range. If they found somebody who's more than 3 years behind, they said, well, we don't want to turn this down, so we'll just put the kid in anyway. Well, you designed a program for somebody who's behind, but not way the hell behind, right? You also aren't assessing disabilities. They didn't assess. None of the tutors were trained in special education. So how many of these young people who are 1 to 3 years behind have a learning disability? Well, I would say probably between 30 and 40% at least. In the general population, it's between 30 and 40%. Those behind might be 50, 60%, right? So that was a problem when we got into studying it. We found that out. And then the third problem was No Child Left Behind. Because of No Child Left Behind, if you're in a failing school, No Child Left Behind had just been implemented. People weren't used to it, right? If you're in a failing school, you're entitled to tutoring by definition. If you're behind, you're entitled. So this group was a group that was actually entitled to tutoring in their schools, school-based tutoring. Now, so what we eventually found out is in the control group, 60% of the kids got tutoring. And 60% in the treatment got tutoring because a lot of these kids didn't want to go home from school. They didn't like school anyway. They get home from school, and now I got this tutor going to come to my house. I think I'm not going to be here when the tutor gets here. So 60% of them got, so we're comparing, actually our evaluation wasn't tutoring to nothing. It was school-based tutoring to home-based tutoring. Now, why might home-based tutoring not work very well? Why would a child welfare agency do home-based tutoring? Actually makes a lot of sense in a place like Los Angeles because there's 89 school districts in Los Angeles County. 89 school districts. That's the largest child welfare jurisdiction in the country, by the way. More kids in foster care in LA County than any other state. 89 school districts. So like, hell, we can't, they, rightly or wrongly, they just decided we can't really develop tutoring relationships, remedial ed relationships with 89 school districts. We'll find the kids that are behind and we'll provide them tutoring. It made some sense. But if you start breaking that down, now you're saying, these kids know a lot of kids are getting tutoring, but they're getting it at school, but I don't get it at school. I got to go home. And get at my school, they just got added to. So when this evaluation was actually invaluable to Los Angeles County to realize this was not a good strategy for providing tutoring. So it wasn't entirely a lost cause, but was it effective? No, right? The reasons are informative. We should think about those reasons when we design things. The last one is the most important lesson, because here I think the lesson is broader than just this context. And that was the classroom-based life skills training program. These things are all over the place. To this day, that's the most common service available to transition-age foster youth. Life skills training, and it's generally in some kind of classroom format. This program is operated at community colleges by something called the Community College Foundation. There are 19 community colleges in LA. California has a great system of community colleges. That's the place young people were most likely to go to school, aging out. And low-income young people generally, that's the place they would start. Both my siblings, I got lucky. I got a scholarship to go to Cal. Both my siblings went to community college for 2 years before they went to a 4-year school. Standard operating procedure in California. Made a lot of sense. They provided transportation to the classes, and they had an outreach advisor. So there was a staff person specifically devoted to, once a young person was referred, let's get them to this class. And they actually got 75% of young people 16 and over who were basically the whole population in LA was eligible for this at a certain age, to go to these classes and complete like 3/4 of them, which they considered like completing the program. And it was 30 hours, 10 weeks, 3 hours a week. Mostly in class, some experiential stuff, right? Might go out to a grocery store to shop, but pretty much classroom-based. Nada, no impact, nothing. Why don't I think it had an impact? First of all, because we ask a bunch of questions, have you gotten help with these kinds of things? And the control group was as likely to have somebody help them with that stuff as the treatment group. The one difference we found in service delivery is the question, have you had a classroom-based life skills training program? Or I think it was literally, have you had a life skills training program? Treatment group, yeah, much more likely than the other group. But when you got down to, has somebody tried to help you look at the newspaper or internet for a job? Has somebody talked to you about savings account? The reality is people in the system, foster parents, group home providers, et cetera, do that stuff, right? So if you're going to do a life skills training program, you got to make sure it's way over and above what's being done generally. And actually, a lot of kids are getting some of that. People are talking to them about that. The quality of it, who knows? Evidently, the quality of this program wasn't enough to have an impact because it didn't. The other thing is, I don't know about, there's a few people in the room, maybe not many, but when I have this conversation with people my age or roughly my age who have young adult children, and I say, how many of you sent your kids to a life skills training class? Like, nobody ever raises their hand. That's not how young people learn life skills. They learn them in vivo. They learn them at the time they need them because they have people to help them with that. Whether they're in a dormitory and they're starting to do it, you got an RA and you talk to the RA about it, or your parent helps you through things, or in home you learn some things. You learn to cook enough stuff so that when you had your own apartment, you were not totally at a loss. Both of my daughters, they could cook probably 10 dinners, and they can make pancakes and waffles and eggs, and they had some skills like that. They had to go out shopping a few times. I mean, not a lot, but they had done some of that stuff. When it came time to find housing, I didn't bother to talk to them about what cosign or all that kind of stuff until they needed to find housing, because they were going to forget it all and come back to me and say, I remember you telling me something about this whole cosigner. What the hell is that? I'm seeing this, So a classroom-based life skills training program when somebody's 16, 17, I think on the face of it doesn't make any sense. Didn't make sense when I worked in the field, by the way. I thought it was kind of silly back then. And so I really wish people would look at that evaluation. And my message to the field there is, I don't think we should be paying for that at all unless the people develop that program have a compelling argument that what they're doing is fundamentally more intensive, different than what we've already evaluated in Los Angeles. And if they have a compelling argument, then let's evaluate the program. But until then, I don't think another dollar should be spent on those kind of programs. Because for developmental reasons, there's a lot of reasons to believe they will not have an impact. And the one we've rigorously evaluated did not have an impact. So the message across those three are actually quite different, right? But that doesn't mean I don't think life skills training. I actually think these intensive case management programs, that's what these workers are doing. The Youth Villages program, you get in that program when you're 18. You've been discharged from either the juvenile justice or child welfare system, and now you're on your own. And these people meet with you a couple times a week. They'll follow you around, see you in the community. They're visiting you out where you live. And then you have a question. I don't know what to do about this, right? So that seems to me a better model of life skills training than classroom-based life skills training. So I know we're over time here, so we're just at time. Okay. Thanks much. Great talking to you.